So it is a pleasure for me to introduce you to our Syringoma book. It's a book that I started writing in conjunction with the Sanplasma removal website on syringomaremoval.com in 2015. It is because we found that Syringoma was also another problem. So we made the content on syringomaremoval.com available into a book, which is now on Amazon. You can get it on Kindle, you can print it if you want, you can get a hard copy of it, and also you can listen to it as well on Audible and iTunes and whatnot. So, but for you, you can get the free PDF copy from the link below. So for you, it's free of charge. Go to the link below and you're going to get your free PDF copy. So thank you very much for watching this, and now you're going to watch the Syringoma book.
Title: All Methods to Remove Syringoma Effectively. Author: Andreas Russo. About the author Andreas Russo. Andreas Russo has been the owner and managing director of Areton Ltd and other limited companies. He speaks English, Italian, Spanish, Portuguese and Chinese. He has great knowledge on the use of electrical arcing for the removal of Syringoma, and he is the creator and formulator, the person who calibrated the formulation of the Sanf remover, also marketed as Syring Remover, the Syringoma home removal solution. He is the author of voltaicplasma.com and the first plasma fibroblast Bible. He is the creator of the BeautyTech plasma pen, the Bay Cream, which is the aftercare product used after several types of aesthetic treatments, and more. He is also a professional property developer and investor. The origins of this book. In 2013, after publishing videos on social media about Sanplasma and Sanplasma removal, and about the use of electrical arcing for Sanplasma removal, Andreas Russo noticed a great demand for a home Sanplasma removal solution. After the introduction of this product into the marketplace, a number of people with strange bumps on their eyelids, which were clearly not Sanplasma but something else, constantly ordered the Sanf remover to remove these other strange skin conditions. We initially constantly cancelled these orders, but at some point we shipped the Sanf remover to a customer with Syringoma, and to our surprise, the customer was pleased with the results. These are the origins of the Syring remover. In the past, cosmetic clinics would charge an arm and a leg to remove Syringoma. This was outrageous because Syringoma removal is relatively inexpensive if you have the right knowledge and if you use the right methods or products. For this reason, Andreas Russo wrote the content in syringomaremoval.com. The content of the website is now compiled here for you to study and absorb. Note that before syringomaremoval.com, there were no organized information about all the possible ways to remove Syringoma. Because of this lack of organized information, also doctors and aesthetic professionals were not well informed on the way to remove these lesions. Because of this lack of knowledge, Sanplasma removal procedures were expensive. Here you will find all about the most effective ways to remove Syringoma. In short, the main purpose of this book is to make professional and the public aware of all the most effective ways to remove Syringoma so that their removal is not as expensive. What are Syringoma? Syringoma are small benign tumors. They are usually found on your upper and lower eyelids. Though rare, they may also occur on your chest, abdomen, and genitals. These harmless growths result when the cells from the sweat glands are overreactive. They usually begin to develop in young adults, but they can also occur at any age. Syringoma are harmless sweat duct benign growths, typically found clustered on the eyelids. However, they may also be found on the armpits, belly button, and any other parts of the body. When these benign lesions are not located on the periorbital region, they are referred to as eruptive syringoma. The name syringoma is derived from the Greek word syrinx, which means pipe or tube. The name suggests the exact problem of the condition, which is a benign overgrowth of the sweat tube cells on the epidermal part of the skin. It is important to emphasize that syringoma are benign lesions and do not pose any threat to health. Therefore, they can be left untreated and they are only removed for cosmetic reasons. Normally, people seek to have only periorbital syringomas removed because they are the most visible and the most difficult to conceal with makeup. The left-hand side picture is used to illustrate in which layer of the skin syringoma are developed. As mentioned above, syringoma are found on the epidermis and are small benign growths of the final part of the sweat duct tubes on the epidermis. Syringoma come in many different shapes and colors. They can be oval, dome-shaped, or round. Their size can vary from syringoma to syringoma. Periorbital syringoma can be both clustered unevenly in one region only, or quite well distributed throughout the area of the skin around the eyes or the eyelids. The word syringoma is normally associated with the small plaques around the eyes. However, it has to be remembered that they often appear on any other part of the body, eruptive syringoma. The reason for the association of syringoma to a periorbital skin condition, which means a condition developed around the eyes, is due to the fact that people seek to have them removed, especially when they develop around the eyes. Periorbital syringoma are skin-colored or yellowish firm rounded bumps 1 to 3 millimeters in diameter, and they are often confused with symphilasma because of their color as well as their presence around the eyes. Syringoma can appear at any age, however, they usually occur after puberty. Syringoma can develop in people of any race and gender. Females seem to be more affected than males. This may not be due to the condition actually affecting more women than men, rather because women are generally more self-conscious than men and seek help more often. Who's at risk of developing syringoma? As we just said, syringoma can develop at any age, although they usually occur after puberty. Anyone can develop syringoma, any race and either gender, although females are more commonly affected. Syringoma sometimes run in families. Up to 18% of people with Down syndrome have syringoma. People with diabetes are more likely to have a type known as clear-celled syringoma. A less common condition, eruptive syringoma, is more commonly seen in people with darker skin. Most common location of syringoma: upper eyelids, lower eyelids, armpits, chest, abdomen, forehead, genitalia. In the bottom picture, you can see the classic periorbital syringoma. In this case, these lesions are easily recognized as syringoma given their skin-like color and their clustered formation. Syringoma are believed to be of familial origin. Around 18% of people with Down syndrome have syringoma. As mentioned earlier, people with diabetes are more likely to have a syringoma type known as clear cell syringoma. Illustration: syringoma around the eyes or periorbital syringoma. As we have previously mentioned, not all syringoma grow on the eyelid area. There is another type of syringoma called eruptive syringoma. Eruptive syringoma appear abruptly in adult life as a crop of multiple lesions, typically on the chest or lower abdomen. Most people with eruptive syringoma are Asian or dark-skinned. Illustration: periorbital syringoma. How is syringoma diagnosed? Most cases are diagnosed by looking at the appearance of the lesion. A biopsy may be needed to exclude other similar types of tumors, as well as basal cell cancers. Biopsies of syringoma show coma-shaped sweat ducts in the dermal deep layers of the skin. How is syringoma treated? Syringoma are benign, so they do not require treatment. However, they may be treated if they are disfiguring. The aim of the treatment is to reduce the visibility of the tumor rather than eliminate it completely. This reduces the risk of scarring. In order to achieve this, the upper portion of the syringoma is treated, reducing its size. If complete ablation of tissue removal is carried out too deeply, scarring may result. More recently, fractional ablative lasers have been introduced, allowing treatment of the deeper parts of this lesion with much reduced risk of scarring. People with darker skin types are at greater risk of scarring. It is wise to treat a small test area first. If this is successful without complications or unacceptable scarring, then a larger area can be treated. Remember that syringoma can recur after treatment. Causes of syringoma. Syringoma is a benign or non-cancerous growth caused by overactive sweat glands. Syringoma usually develop on the neck, upper eyelids, lower eyelids, but occasionally they can also grow on the abdomen, armpits, scalp, belly button, and genitals. In most cases, syringomas are harmless and do not present any other symptoms. Rarely, however, some individuals with syringoma experience extreme pain and itchiness, especially when sweating. Causes of syringoma. The name syringoma is derived from syrinx, the Greek word for tube or pipe. Syringoma are benign tumors of the sweat ducts, eccrine glands. These tumors lie in the mid to deep dermal layers of the skin. Syringoma can be caused by anything that increases the sweat gland productivity, which may lead to this type of tumor growth. Usually, the root cause of syringoma is a hormonal imbalance. Some other possible causes may include genetics, Down syndrome, diabetes, Marfan's syndrome. Where do syringoma grow on the body? They grow on upper eyelids, lower eyelids, armpits, chest, abdomen, forehead, genitalia. Facts on syringoma. Syringoma mostly develop in early adulthood between the ages of 25 and 30. Syringoma are linked to several different medical conditions, including diabetes. Although rare, some people have a genetic predisposition towards developing them. Once syringoma have been diagnosed, there is usually no reason to treat them or remove them. Signs and symptoms of syringoma. Syringoma usually appear as small bumps that grow between 1 to 3 millimeters. They are either yellowish or flesh-colored. They are typically found in symmetrical clusters on both sides of the face and or the body. Eruptive syringoma are usually found on the chest or abdomen, and they appear as multiple lesions occurring all at the same time. Syringoma are neither itchy nor painful and are usually asymptomatic. A syringoma is a skin-colored or yellowish, firm, rounded bump. It is very well defined and sized 1 to 3 millimeters in diameter. Syringoma usually first appear during puberty, but additional lesions can develop later on in life. They are not itchy nor do cause pain. Who develops syringoma? Syringoma can occur at any age, however, they mainly appear after puberty. Sometimes they also grow during puberty. Syringoma can develop in people of any age and of either gender. However, females are more commonly affected. Syringoma sometimes run in families. Up to 18% of people with Down syndrome have syringoma. People with diabetes are more likely to have a type known as clear cell syringoma. A less common condition called eruptive syringoma is more commonly seen in people with darker skin. What does syringoma look like? Syringoma are skin-colored, small lumps measuring between 1 to 3 millimeters in diameter. In people with dark skin tone, they may appear as yellowish or pale lumps. Syringoma are more common in women and most frequently appear during or after adolescence. The most common location is around the eye area. Eruptive syringoma appear on the trunk, chest and abdominal area. Syringoma are yellow, brown, pale pink and skin-colored. Usually syringoma develop over time, but some people, especially younger individuals, may experience sudden or eruptive syringoma. Eruptive syringoma often cause intense itch as well as redness and pain. The majority of syringoma are not associated with any symptoms. Some people may experience itch with sweating. What other problems can occur with syringoma? The majority of syringoma appear almost suddenly over the course of a week or two. Inherited factors play a role in some cases. Inherited syringoma usually occur in pre-adolescence. Eruptive syringoma have been reported in Down syndrome. Syringoma have also been associated with other rare genetic conditions such as the Brooks syndrome. Syringoma are often mistaken for other skin conditions. Conditions with symptoms similar to syringoma include milia, xanthoma, sebaceous hyperplasia, acne vulgaris, flatwarts, basal cell skin cancer at times. Illustration: syringoma around the eyelid area. Eruptive syringoma. Generalized eruptive syringoma is a relatively rare clinical condition of a benign tumor of the eccrine sweat ducts. It shows up as crops of small flesh-colored papules on the body. It generally occurs during puberty. Treatment of this benign condition is cosmetic only. What is different about eruptive syringoma? Whenever we hear the term syringoma, we automatically associate it to those unsightly benign formations around the eyes that people try and cover up by using camouflage makeup. When the same sweat duct superficial growths appear on the other parts of the body, they are commonly referred to as eruptive syringoma. They can appear on the forehead, armpits, neck, belly, and almost any part of the body. Like periorbital syringoma, they are completely benign and they are only removed for cosmetic reasons. Eruptive syringoma do not cause any discomfort and are not as dangerous as such. Generally, when people refer to syringoma, we refer to the periorbital benign formations around the eyes. When they appear on other parts of the body, they are referred to as eruptive syringoma. Eruptive syringoma can appear almost on any part of the body. However, they have been rarely found on the genital area, although some authors maintain that those pubic syringoma should be considered as a differential diagnosis of pubic papular dermatitis. Illustration: eruptive syringoma on the neck area. More about eruptive syringoma. Syringoma are benign tumors of eccrine origin with 4 principal clinical variants. In eruptive syringoma, as described by Jack and Darier in 1987, the lesions occur in large numbers and in successive crops on the anterior chest, neck, upper abdomen, armpits, and the belly button region at puberty or during childhood. More rarely, cases of eruptive syringoma spreading throughout other parts of the body have been also reported. It occurs more frequently among women. These lesions consist of asymptomatic multiple small-form yellow-brown colored papules. These lesions are benign and may spontaneously resolve over time, or, more commonly, remain stable. Treatment of this benign condition is cosmetic only. Clinically, it may be mistaken for acne vulgaris, sebaceous hyperplasia, milia, eruptive xanthoma, urticaria pigmentosa, xanthelasma, etc. Definite diagnosis can be made upon histological examination because syringoma demonstrate distinctive histological features. Illustrations of histological examination of 2 syringoma. Illustration of eruptive syringoma on the abdomen. It is corroborated that the condition could be triggered by waxing. Waxing could induce a subsequent reactive inflammatory process resulting in a hyperplastic reaction of the eccrine sweat ducts. According to a recent study, in one case, the suspect cause of triggering eruptive syringoma was the use of certain types of drugs. Unfortunately, once eruptive syringoma are formed, they persist for a long time unless they are removed. Most people with eruptive syringoma are Asians or dark-skinned. To put it simply, when syringoma appear on any part of the body other than the face or eyelid area, they are generally referred to as eruptive syringoma. When syringoma appear on the face or eyelids, it is referred simply to as syringoma. Illustration: eruptive syringoma on armpits. Illustration: eruptive syringoma on abdomen. Syringoma do not discriminate. If you have syringoma, do not think you are alone. Syringoma is a color-blind benign skin condition, which means that syringoma can affect any type of skin: Caucasian, Asian, Indian, black, etc. Therefore, syringoma do not discriminate about race. On the other hand, it does not discriminate about age either, because people normally develop syringoma during their puberty, or mainly after their puberty, and syringoma will be there to stay unless you have them removed. Illustration: periorbital syringoma in Caucasian. In the picture below, a Caucasian with the typical clustered periorbital syringoma on the right lower eyelids. These lesions are easily removed in one session with laser or electrofulguration. Illustration: periorbital syringoma in middle-aged Caucasian. In this picture, it is possible to appreciate how the syringoma can spread over the whole periorbital region. These are lesions that can be difficult to disguise with makeup because they are raised. Illustration: periorbital syringoma on Asian skin type. Living with syringoma. You do not have to live with syringoma because they can be easily removed, but you do not have to have them removed either after all. This is because syringoma are benign and therefore the removal is optional. If you are really self-conscious of this benign skin condition, then you can go ahead and have them removed. But do you really want to have them removed? It is possible, but please watch the video below first. This nice lady has something really important to say about Syringoma, since she has decided to have her Syringoma not to affect her life. She's admired for her self-confidence. So, if you have decided to live with Syringoma, or you're waiting for laser treatment, or your Syringoma removal cream is about to arrive, you can use camouflage makeup meanwhile. It is quite easy, just watch this quick tutorial. The results are amazing. What are the options for Syringoma removal? The options for Syringoma removal and treatment are chemical peels. TCA, or trichloroacetic acid, allows easy removal of Syringoma, usually within 1 to 2 treatments. This makes the product very successful within cosmetic clinics because the client can see the results soon after the first session, and the results are achieved within a relatively short time frame. However, TCA is not very easy to control, and compared to other types of cosmetic peels, it could be too aggressive on certain skin types and more prone to cause hypo or hyperpigmentation than other types of peels. Therefore, it may not be the best option for home use, given that there are milder peels available on the market which are easier to control. Illustration: TCA peel set. Laser removal. The Syringoma laser removal method is similar to electrolysis or electrical arcing in removing Syringoma, but slightly more difficult to perform and also more dangerous. Electrofulguration. Electrofulguration is one of the preferred methods for Syringoma removal. By using this technique, Syringoma are removed safely by using a mild electrical arc. Excision. Excision is the oldest method of removing Syringoma. It consists in using the same procedure used for skin cancer excision. This is a very effective procedure in removing Syringoma within 1 session. However, it is very invasive. Bleeding will inevitably occur during the surgical procedure. The use of local anesthetic is mandatory. There are risks of infections. The procedure will almost inevitably scar the patient. This type of procedure is to be avoided due to the high chances of scarring the patient. Given all the modern techniques available, there is no reason for this type of treatment to be used any longer. Illustration: excision of a mole. Cryotherapy. This removal treatment involves freezing the Syringoma with liquid nitrogen or another chemical. This technique is known as cryotherapy. The liquid nitrogen treatment has been proposed as a possible Syringoma removal treatment. Liquid nitrogen Syringoma treatment is referred to as cryosyringoma ablation, and you will see this option come up from time to time. However, the dangers of applying extreme low temperatures to your eyelids and the disappointing results have made this removal treatment the least favored. It is simply too dangerous, destructive, and the results are unreliable. Syringe remover. Generally, there are very low risks in applying specialized peels to achieve complete Syringoma removal. Peels are generally the preferred option for Syringoma removal. This is because they are inexpensive and proven not to cause scarring if used properly. Using peels in clinics. TCA peels in clinics. When it comes to specialized peels, the preferred option for Syringoma removal in cosmetic clinics is TCA, trichloroacetic acid. The main reason is that TCA allows removal of Syringoma usually within 1 to 2 sessions. This makes this product very successful within cosmetic clinics because the client can see the results soon after the first session, and the results are achieved within a relatively short time frame. However, TCA is not very easy to control and compared to other types of cosmetic peels, it could be too aggressive on certain skin types and more prone to cause hypo or hyperpigmentation than other types of peels. Therefore, it may not be the best option for home use, given that there are milder peels available on the market which are easier to control. TCA is a non-toxic chemical, trichloroacetic acid, which has been used to perform skin peels for over 20 years. It is a relative of vinegar, acetic acid. When TCA is applied to the skin, it causes the top layers of the skin to dry up and peel off over a period of several days, up to 1 week. When the old skin is peeled off, it exposes a new layer of undamaged skin which has a smoother texture and more even color. Some dermatologists, in fact, still prefer TCA peels for treating sun damage or melasma, usually in combination with prescription creams. TCA peels are safe in the hands of an experienced dermatologist. TCA peels may be a good option, particularly if you have syringoma. Usually, the main choice for syringoma removal in cosmetic clinics is the use of TCA-based peels. This is because if used properly and at the right concentration, TCA allows removal of the syringoma in 1 to 2 sessions only. This is ideal to both cosmetic clinics as well as the customers because this allows achieving the best possible results within a few sessions only. However, if the concentration is too high or the application of TCA is not done appropriately, this cosmetic procedure could result in mild scarring, which is a very rare occurrence anyway. On the other hand, if the concentration of TCA is too low, the results will not be apparent and the client will not be satisfied. So, by using the right concentration of TCA, it is possible to remove the syringoma in 1 or 2 sessions. Remember that TCA is the best choice in cosmetic clinics because results are achieved and appreciable in a short time frame and few sessions. This makes both the client wanting to have their syringoma removed and the beauty therapist usually very satisfied. The client is happy because their problem is resolved and the beauty therapist has a justification to build the happy customer. Illustration: TCA peel set. The drawbacks control. Although very effective, the use of TCA requires a certain experience and training in order to be used properly and achieve good results. This is because TCA is very effective but not as easy to control as other cosmetic peels. And for this reason, neutralizers sometimes need to be used during the cosmetic procedure. The main reason for this sort of control difficulty of TCA is that TCA is not as easy to neutralize by using water as the alternative glycolic and mandelic acid, for example. These are some of the effects of TCA for syringoma removal. Excessive eyelid swelling. This occurs 1 or 2 days after the application of TCA on the upper or lower eyelids. Stinging, numbness and burning of the skin. Skin peeling, including excessive peeling if you have a medium or deep peel. Redness, which can range from the color of a mild sunburn to a deeper red depending on the peel. Crusting or scabbing of the skin due to the skin cells being removed. Increased photosensitivity, sensitivity to the sun that can lead to hyperpigmentation. In some cases, when someone has sensitive skin, scarring or dermatosis, pigments problems can also potentially occur. Additionally, as stated above, TCA is not very easily controllable, and the most effective way to stop its acidity is to use a neutralizer. Please note that rinsing with water and drying the area can help but will not stop the effects of TCA immediately. Illustration: syringoma on upper and lower eyelids. Skin type. Dark skin type, type 5 and 6, do not seem to respond as well to TCA because hypopigmentation develops quite easily after the use of strong TCA peels. Also, skin type 1 is generally quite sensitive to TCA, meaning that lower strengths of TCA concentrations may be required for syringoma removal, and therefore syringoma removal may not be achievable within 1 to 2 sessions. Also, there are other two issues with the use of TCA peels for syringoma removal. It causes burning, stinging sensation during its application, normally tolerable. Swelling tends to develop on the area where TCA was applied, especially on the upper eyelids. This generally occurs 1 or 2 days after the application. Illustration: the 6 Fitzpatrick skin types. Therefore, TCA is the best candidate in cosmetic clinics and the world over for syringoma removal, as well as removal of many other benign skin lesions, because it is very effective in the removal of lesions in general. However, there are other peels types which can be used and have neither the same drawbacks as TCA nor its complexity. How do TCA peels work and what are the different depths of peel? All peels work by chemically removing a layer of skin. Superficial or light peels remove only the top layer, mostly the layer of dead skin called the stratum corneum. Progressing from medium to deep peels, the layer of the skin removed is greater with each increase in strength of the TCA peel solution. The stronger the TCA peel solution, the greater the risk of complications like uneven pigmentation or even scarring after syringoma removal. TCA peels can be performed at different skin depths, from shallow to deep. Most dermatologists now are using laser technology instead of deep TCA peels for syringoma removal. Lighter TCA peels are usually performed in a series of 2 or 3 for best results. This is similar to other types of peels that usually involve the use of hydroxy acids such as glycolic, salicylic, or a mixture of other hydroxy acids. Medium depth TCA peels are usually done once or twice a year and do require some downtime, usually about a week, when the peeling is obvious. Illustration: the use of TCA for syringoma removal. Watch the effects of TCA for syringoma removal being used in a reputable cosmetic clinic. As you can see, the effects are similar in some of the products you can buy online. Although it is not mentioned in the video, we believe that the active ingredients used is either TCA or BCA due to the whitening of the area where the product had been applied. Also, the mild swelling as well as the dark scabs suggest the use of this type of peels. Syringoma removal using lasers. Syringoma laser treatment is very effective in removing syringoma, but it is very expensive. The syringoma laser removal method is very similar to electrolysis or electrical arcing when removing syringoma, but slightly more difficult to perform and also slightly more dangerous. Laser treatment. Visible and invisible light beams are concentrated and sent through a laser aimed at the syringoma, destroying its tissues. Laser treatment is usually the preferred option for syringoma removal because it significantly reduces the risk of scarring and infection. And in many cases, it only takes a single laser procedure to remove the growths entirely. Lasers are the preferred option for benign skin lesions removal in many cosmetic clinics. This is due to the high degree of accuracy of most modern cosmetic lasers, and because of this high accuracy and precision, the risks of scarring are very low. Generally, the results are very good for benign skin lesions removal and consequently for syringoma removal. CO2 laser for syringoma removal. Welcome to the state-of-the-art technology for cosmetic treatments. Lasers are often associated with high technology and safety in cosmetic treatment for mole and benign skin lesions removal in general. The perception is not mistakenly placed. Lasers are very effective in removing little moles and birthmarks with a high degree of accuracy. This means that, if used properly, laser syringoma removal can have excellent results in one session only. The preferred type of lasers used for this cosmetic procedure is called CO2 fractional laser. If used for common eruptive syringoma removal, usually one ablative session per syringoma will suffice in order to remove these benign lesions by using the CO2 laser. Illustration: CO2 laser in action. On the other hand, when removing or treating periorbital syringoma, it is usually recommended a minimum of 2 sessions. The first ablation or first treatment is used to coarsely burn the main bulk of the syringoma. The client usually requires 2 to 3 weeks to recover from the treatment fully. After the recovery, if the results are good, the client can undergo a deep peel at the clinic of the area treated by the CO2 laser, or be prescribed a course of daily peels at home to smooth the area where the treatment was carried out. In case there are still bumps left after the first treatment, another laser session may be required to flatten the bumps. After the second recovery, then a peel treatment can be carried out in the clinic, or a number of home-based peels treatments can be carried out instead. Therefore, the first line of cosmetic treatment is usually to destroy these sweat duct tumors by using the CO2 laser. A topical anesthetic is usually required to be applied on the area to be treated with the laser to ensure maximum comfort for the client. However, these unsightly benign skin lesions don't go away without a fight. Sometimes they are quite difficult to eradicate in just one session because they tend to regrow quite quickly. Because of this tendency of growing back after the CO2 laser treatment, there may still be small flat bumps which can be leveled off using cosmetic peels. The cosmetic peels that can be either for home use, i.e. glycolic acid at 10-20% concentration, or mandelic acid 20 to 30%, or if the cosmetic practitioner prefers, 1 or 2 sessions of high concentrated peel can be applied. This concentrated peel can be applied as appropriate on the patches where the syringoma are still slightly raised. Numbing creams and anesthetics. Although lasers are considered to be high-tech, even a mild superficial ablation with a laser can be uncomfortable or even painful. Even with the use of lasers, it is always advisable to numb the area before treatment. In cosmetic or beauty clinics, the preferred option are topical anesthetics containing 5% emulsion preparation containing 2.5 lidocaine/prilocaine respectively. These preparations are usually available without prescriptions from the local chemists. These types of topical anesthetics are normally used also by tattoo artists to numb the area before tattooing. Since tattoo artists are normally not medically qualified, there is usually a mild topical anesthetic available without a prescription, depending on local legislation. At dermatologists' clinics, usually up to 20% concentrations of lidocaine are used in topical anesthetic creams. Normally, local anesthetic injections are not required for this simple procedure. However, some doctors accustomed to administering injectable lidocaine can opt for local anesthetic. The advantage of local anesthetic is the fact that the area will be numb within a few minutes following the injection. Aftercare. The aftercare is minimal after this type of procedure. Although the risks of infections are very low after a superficial cosmetic procedure, it is advisable to instruct the client to apply the appropriate antiseptic cream twice a day. This will drastically reduce even further the risks of mild infections. In order to reduce the risks of hyperpigmentation, sunscreen must be worn daily for at least 3 months after the last treatment. Side effects of laser treatment. Pain. Most people feel very little pain during the treatment if the appropriate anesthetic cream is used. Redness. A pink color may persist for 2 weeks to 2 months after the laser treatment. In rare instances, it may last 3 to 6 months. This is more common in people who have a history of flushing or blushing easily, or who have already had dilated vessels on the surface of the skin. Wound healing. The CO2 laser causes a superficial wound to the skin that takes approximately 2 to 10 days to heal. The superficial injury of the outer layer of the skin may result in mild to moderate swelling. Crusting is rare, but peeling is common. After the treatment, the skin may be sensitive to the sun for approximately 4 to 6 weeks. Pigment changes. The treated area may heal with increased or decreased pigmentation. This is rare and occurs most often in darker skin 2 to 6 weeks after the treatment. Hyperpigmentation usually fades in 3 to 6 months, although rarely pigmentation changes can be permanent. Excessive swelling. The day following the laser treatment, there will be swelling of the skin. This is temporary and will resolve over 3 to 7 days. Scarring. There is a very small chance of scarring. This includes hypertrophic scars or very rarely keloid scars. Keloid scars are thick raised scars formations. To minimize chances of scarring, it is important to follow post-operative instructions carefully. It is important that any prior history of unfavorable healing be reported. Infection. Occasionally, infections can occur. If not treated promptly, this could result in scarring. Syringoma and cryotherapy. One of the options to remove syringoma is cryotherapy. This term originates from the ancient Greek word kryo, meaning cold, and therapeia, meaning cure. Cryotherapy is the localized use of very low temperatures in dermatological applications. In dermatology, the main uses for cryotherapy are the treatment and removal of warts, verrucas, and some benign thick moles. Given that cryotherapy equipment is readily available in the dermatologist's clinic, sometimes cryotherapy is used to remove syringoma. Cryotherapy devices are predominantly liquid nitrogen or either compressed inert gases which absorb heat as they are released onto the skin. In other cases, cryotherapy is also used to ablate internal malignant tumors during surgeries. Cryotherapy for periorbital syringoma removal, those syringoma around the eyes, is normally avoided for 2 main reasons. The area to be treated is too close to the eyes, and the area of the skin around the eyes is very delicate and more prone to scarring than the rest of the body's skin. On the other hand, if syringoma are located on other parts of the body where a scar is not important, they can be removed by using this technique. Illustration: ice cubes representing cryotherapy. However, there would be little point in ending up with scars after syringoma removal. After all, they are only removed for cosmetic reasons. Due to the higher likelihood of developing scars after cryotherapy, this is not a cosmetic treatment usually recommended for syringoma removal. Remember that a dermatologist would not normally suggest having syringoma removed because they are not considered to be dangerous as such, and therefore they do not need to be removed other than for cosmetic reasons. Cryotherapy is sometimes used by dermatologists to remove benign skin lesions for cosmetic purposes like syringoma. When cryotherapy is used for cosmetic procedures, it's normally due to the immediate availability of the cryotherapy equipment in the clinic. Normally, cryotherapy equipment is quite inexpensive, and therefore this type of treatment is easily available. However, cryotherapy is not necessarily the best way to treat benign skin lesions for cosmetic reasons. The main reason is that there is usually little control over the dermatological ablation depth of freezing, and therefore the likelihood of scarring could be higher by using this method. However, some of the latest dermatological cryotherapy equipment has been calibrated to be effective for epidermal treatment typical of syringoma removal. Therefore, by using the appropriate cosmetic cryotherapy equipment, it is possible to remove the syringoma and minimize the risks of scarring. Due to our experience with electrofulguration, electrodesiccation and cosmetic lasers, for cosmetic procedures, it is our opinion that cryotherapy has more appropriate uses in the treatment of warts and verrucas. This applies especially in the removal of periorbital syringoma, where we would find the application of highly concentrated deep freeze inappropriate around the eyes. Illustration: liquid nitrogen cryotherapy device in action for wart removal. Risks and side effects of cryotherapy. The most common side effects of any type of cryotherapy are numbness, tingling, redness, and irritation of the skin. The side effects are almost always temporary. Make an appointment with your doctor if they don't resolve within 24 hours. Those with diabetes should not use cryotherapy to remove their syringoma. Disadvantages of freezing cryotherapy treatment. Illustration: example of cryotherapy device used to remove a benign skin lesion on the forearm. The application of liquid nitrogen does sting. Although it's cold, many describe the procedure as feeling of burning. Cryotherapy can cause treatment areas to appear permanently lighter in color, hypopigmentation. Extra caution must be used when treating the face or any other cosmetically sensitive area. It is only appropriate to remove skin lesions on parts of the body that are not as delicate, like the eyelid area. In other words, it is generally effective for the treatment of fully developed skin cancers or deep lesions such as large moles, which grow on other parts of the body away from the eyelid area. Depending on how it is applied and the location of the treatment site, blisters will sometimes form within days following the treatment. Aftercare. No special aftercare is required after the use of cryotherapy. Most dermatologists, however, prescribe the patient to use a course of antiseptic twice a day to avoid potential infections. In other words, after this type of procedure, the aftercare is minimal. Although the risks of infections are very low, it is advisable sometimes to instruct the client to apply the appropriate antiseptic twice a day. This will drastically reduce even further the risks of mild infections. In order to reduce the risks of hyperpigmentation, sunscreen must be worn daily for at least 3 months after the last treatment. Recovery time. After cryotherapy, the skin recovery period varies between 2 to 3 weeks after the treatment. The treatment does not cause any significant downtime. In fact, the patient can restore his normal activities soon after the procedure, but taking special care to avoid infections and strenuous activities until the skin recovery is complete. To conclude, is liquid nitrogen a good treatment for Syringoma? The simple and short answer is no. This is because, comparably, there are better treatments available in order to remove Syringoma safely. DIY Syringoma treatment. Some people do love DIY. This is a fact of life, and even when it comes to removing Syringoma. So we would like to make life easier and most of all safer to all the DIY enthusiasts by publishing this information, which is worth thousands when you manage to get rid of your Syringoma. After listening to this, you should be able to go and purchase all the ingredients yourself and treat your Syringoma. We know that by following all these steps, you are very likely to get rid of your Syringoma without leaving any scar and laugh at all those unnecessarily expensive cosmetic clinics. However, it is always recommended to seek specialist advice because all the effective treatments for Syringoma removal require ablation. The Syringoma sufferer should be assisted in this process in order to remove their Syringoma in the safest possible way and avoid mistakes which could be paid in terms of unnecessary scars. Illustration: Syringoma on lower eyelid. To start, you should know the basics about removal of skin lesions. It does not matter how you will do it. It can be done using laser, electrocautery unit, hyfricator, other equipment, or cosmetic peels. What you are trying to do is ablating, destroying the lesion, and at the same time, you should make sure of two things. Despite the ablation, the dermis has to remain intact and unaffected by the treatment. No infection should develop during the healing recovery process, but this should not be your concern because specialized peels rarely cause an open wound. Taking care of these two important points ensures that the likelihood of scarring is minimized. As mentioned earlier, infections are very unlikely using the methods proposed. Of course, if you used a laser or scalpel yourself, you would need to take care of infections. But we hope that no DIYer would venture to that extent to remove their Syringoma because this is not necessary. Specialized peels for Syringoma. The use of very specialized cosmetic peels to chemically ablate Syringoma has been used for many years and it does work. It does work because this is science. There are many research papers where scientists and researchers have used peels to remove Syringoma. You can find the links as you read this webpage. Remember what we said about dermatological treatments of skin lesions. In order not to leave scarring, we have to leave the dermis unaffected. Trichloroacetic acid and other peels have been used in clinics for a long time to successfully ablate and remove Syringoma. Glycolic acid is another good candidate for successful Syringoma treatment and removal. Also, many other cosmetic peels are very effective in the treatment of Syringoma. Not only has this type of treatment been used in many clinics for years, but also numerous research papers have confirmed the effectiveness of cosmetic peels to treat and remove Syringoma. The results are repeatable and consistent. In order to ablate the Syringoma within a useful time frame, strong peels concentrations are used for the treatment. The normal concentration in cosmetic peel creams are not high enough to ablate the Syringoma. TCA peel for Syringoma treatment. In cosmetic peels, TCA and other peels are the preferred options for treating Syringoma. After all we are doing is ablation, remember? This can be done in many different ways, using acids, laser, and so on. Also remember that we do not want to leave scarring at the end of the treatment. In order to avoid scarring, we have to leave the dermis unaffected. Now, the only problem we have is that the acid used to ablate Syringoma have to be in concentration between 50 and 95% to be effective. These acids are potent ablators, and the wrong acid type and the wrong concentration for your Syringoma or skin type could potentially affect the dermis. Also, using high fluid solutions could be dangerous to your eyes. So, if you are determined to be doing it yourself and you are determined not to seek specialist advice, you could be placing your skin and your eyes under unnecessary risk. So, although you can purchase acids cheaply from the internet, we strongly recommend you to consult a specialist first. Within the price of the syringe remover, we help you by providing you the best gel formulation for your syringoma and skin type. Also included in the syringe remover price, you have our professional service. So should you have any questions or concerns, we will be happy to help you throughout your treatment. In this way, you can remove your syringoma effectively without taking unnecessary risk, and you can do it from the comfort of your own home with all our support. In science, when we find the cause of the desired effect, in order to reproduce that effect, we have to reproduce the cause that produced it. In other words, given that this treatment is effective in cosmetic clinics, it is also effective in your own home if you use the same principles. In other words, given that this treatment is effective in cosmetic clinics, it is also effective in your own home if you use the same principles. So, what is used in cosmetic clinics? Cosmetic clinics predominantly prefer strong TCA peels for this type of application. So to summarize, you can purchase peels from the internet, a local laboratory, or pharmacy at a very low price. The peel concentration varies from 50% to 95% depending on your syringoma and skin type. The type of peel selection and the other ingredients also depend on your skin type. Unfortunately, the cheap peels you find on Amazon and eBay usually come in fluid solutions and not a gel as required for the safest way to remove syringoma at home. Additionally, these cheap peels are not made for this application and they may lack the important additives in order to make them suitable and safe for home use. Also, should you have any questions throughout the treatment, you will have no support from the place you purchased the peel. What type of peel should you use? What concentration should you use? This depends on your skin type, your age, and type of syringoma. If you use the wrong formulation inappropriately, you could potentially be scarred. So you can do it all by yourself. However, given the above risks, we strongly recommend you to seek specialist advice before trying any specialized peels on your own skin. It does not matter whether the advice comes from syringomaremoval.com, through the syringe remover, or other specialists, as long as you are being properly advised. Syringoma removal using cosmetic peels. One of the options for syringoma removal is the use of peels. Cosmetic peels are a very good option because not only are they very effective, but also easily available on the market, and they are not classed as medicine. In order to remove syringoma within a useful time frame and few number of sessions, usually the concentrations used start from 40% and above. The concentrations used vary according to the type of peels used, i.e. whether it's TCA, glycolic acid, mandelic acid, pyruvic acid, etc. and whether the formulation comes in a gel or fluid solution. How are syringoma removed by using peels? When using peels for syringoma removal, we are applying a chemical ablation. One difference between a chemical ablation and the ablation by vaporization, i.e. electrofolguration or laser removal, is that the real effects of the chemical ablation are not immediate and kick in a couple of days after the application of the peel. Therefore, with chemical ablation, the ablative effects of the syringoma are similar to those of lasers or other cosmetic equipment, and for this reason, the results are similar. However, often cosmetic clinics promote lasers or electrofolguration equipment as the best option for Syringoma removal. The real reasons are twofold: the higher perceived value associated to laser treatments and the other cosmetic equipment in general. And Syringoma can be removed in one session by using lasers. However, the use of peels for Syringoma removal present their advantages over the use of cosmetic lasers and other equipment. What are the advantages of using peels versus electrofulguration and laser removal? Laser and electrofulguration removal are the preferred option in cosmetic clinics for Syringoma removal because they allow quick removal within one session, provided that the practitioner is adequately trained. As usual, one session only will suffice to level off the Syringoma and achieve the desired results. Also, the perceived added value of cosmetic procedures carried out by using cosmetic lasers dictate high prices and are quite profitable to the clinics. However, are these high prices really worth it compared to the use of specialized peels for Syringoma removal? You'll find the answer on our website, syringomaremoval.com. What are the disadvantages of using peels? Leaving the problem of Syringoma recurrence aside, the main disadvantage of using specialized cosmetic peels for Syringoma removal is that it is not often possible to achieve the same results possible with the use of cosmetic lasers or electrofulguration equipment within one session only. By using specialized peels, more than one session may be required in order to achieve similar cosmetic results which can be achieved with lasers in one session only. The need to split the treatment into various sessions can be seen as a disadvantage from the cosmetic clinic's point of view, and this is the reason for TCA being the preferred option in cosmetic clinics. What are the advantages of using peels? Less likelihood of scarring, because the outcome of the cosmetic treatment is less dependent on the beautician's ability in using cosmetic equipment, as it is in the case of lasers and electrofulguration equipment. After all, when using cosmetic lasers or electrofulguration equipment, the results are more dependent on the user. No need for anesthetic because the treatment is virtually pain-free. Some burning sensation may be experienced at the beginning of the treatment. However, this will subside within 5 minutes as it is bearable for most people. Syringoma treatments by using peels are generally more cost-effective because cosmetic peels are easily available on the market and generally they are not heavily regulated. This means that even if Syringoma will recur at a later stage, they can be removed again safely and inexpensively by using specialized peels for Syringoma removal. By using certain formulations, Syringoma removal can be easily done safely at home in multiple sessions. What types of peels can be used for Syringoma removal? Generally, the preferred option for Syringoma removal are bichloroacetic acid, BCA, or trichloroacetic acid. These are the preferred peels in beauty clinics because they are generally very effective and strong. It is possible to remove Syringoma in 1 or 2 sessions only by using strong enough concentrations. Some other types of peels that can be used for these applications are glycolic acid or pyruvic acid. These two options, glycolic and pyruvic acid, are milder alternatives, and they are seldom used in cosmetic clinics because it is usually required more than one session to obtain good cosmetic results. However, these types of peels are far less aggressive than TCA and hence more suitable for home use. Note that using certain concentrations incorrectly without certain milding ingredients and in fluid solutions could cause scarring if misused. Aftercare. The aftercare is minimal after this type of procedure. Although the risks of infections are very low after a superficial cosmetic procedure, it is advisable to instruct the client to apply the appropriate antiseptic cream twice a day. This will drastically reduce even further the risks of mild infections. In order to reduce the risks of hyperpigmentation, sunscreen must be worn daily for at least 3 months after the last treatment. Syringoma peels for home use. Syringoma removal using peels at home. As we have seen, TCA is the preferred peel option for syringoma removal in cosmetic clinics alongside lasers and electrodesiccation or electrofulguration equipment. The main reason for preferring those methods is generally the excellent results of these cosmetic procedures, which are achieved within 1 session. However, when it comes to syringoma removal at home, the game changes because it is possible to apply the peel at regular intervals until complete removal. There is no rush after all. Therefore, milder peels like glycolic or mandelic acid allow removal in stages. Why using peels at home? The main problem associated with syringoma removal in cosmetic clinics is that not only is it expensive, but syringoma recurrence dictates that in some cases these cosmetic treatments should be repeated periodically in order to maintain good cosmetic results by keeping the recurrent syringoma at bay. Because as we have seen, syringoma, once removed, can return, and in some cases they seem to turn into chronic condition. Therefore, the option of a home removal cosmetic treatment is very convenient, especially for those who have tried lasers, TCA, and other treatments having experienced subsequent recurrence problems. The best cosmetic peel solution we have found for home syringoma removal is the use of glycolic and mandelic acid in a gel formulation. We have moved away from the option of using TCA because although very effective, TCA is not very easy to control. In other words, it is not easy to control the chemical ablative effects of TCA without some form of training. This does not take away the safety of TCA, of course. Additionally, TCA is a very strong chemical peel, and as a consequence of its application, swelling often occurs 1 or 2 days after use. The swelling normally subsides 3 to 4 days after the application. However, swelling is not a pleasant experience to have at home, and people who are unfamiliar with its effects can easily become worried. Also, TCA causes more hypopigmentation on type 5 and 6 skin types, dark skin types. Illustration: TCA peel set. When it comes to syringoma removal at home, other peels are preferred like mandelic, pyruvic, and glycolic acid. This is because the ablating effects of these peels can be stopped by simply wiping the gel off and rinsing it with water. This has been corroborated not only by scientific studies but also by our own experience with those type of peels. For this reason, their cosmetic ablation effects are easily controllable and therefore deemed more suitable for home removal. Moreover, swelling does not always occur after the use of those types of cosmetic peels, and therefore this is a huge advantage versus TCA for home use. The product we use in the syringe remover is a thick formulation for 2 main reasons. Avoid drips formations during the application, which always comes in handy when removing lesions. Also, a gel formulation allows lower peel concentrations to have similar effects of much stronger solutions. Both mandelic and glycolic acids are very stable and therefore last long, minimum 12 months shelf life in a gel-like formulation. TCA does not last long in a gel formulation, usually a maximum of 6 months from production. The concentration of peels for syringoma removal at home should be between 70 and 95% for glycolic acid gel plus milding ingredients, 75 and 100% if mandelic acid is used plus milding ingredients, pyruvic acid 50 to 80% concentration plus mild ingredients. If the concentrations are too low, the ablation effects will be too mild and the user will quickly become frustrated at the lack of results. On the other hand, if the concentration of the speos is too high and without mild ingredients, the formulation could result too aggressive. This could result in excessive swelling, overablation, which could consequently result in scarring if used recklessly. The fact that the peel is formulated in a thick gel consistency also adds the advantage that the active peel, mandelic, pyruvic or glycolic acid, remains effective over time. Remember that the home formulation should be applied in 2 to 3 weeks intervals because every time the gel is applied, the area should be left to recover before reapplying. To summarize, the disadvantage of using milder formulations at home is that multiple applications may be required to achieve the desired effects. However, milder peels used at home present the added advantage that they can be used in complete comfort at home. Aftercare. The aftercare is minimal after this type of procedure. Although the risks of infections are very low after a superficial cosmetic procedure, it is advisable to instruct the client to apply the appropriate antiseptic cream twice a day. This will dramatically reduce even further the risks of mild infections. In order to reduce the risks of hyperpigmentation, sunscreen must be worn daily for at least 3 months after the last treatment. Syringoma recurrence. Syringoma can recur after removal. Therefore, when you are selecting the syringoma removal treatment, you should consider the possibility of recurrence because this can happen even when the removal has been carried out appropriately. In fact, even if the syringoma have been removed properly by using peels, lasers, electrofulguration, etc., they can reappear a few months after the cosmetic treatment. According to a published study, the recurrence rate measured 2 months after treatment was nearly 15% of the total number of people who underwent removal with a CO2 cosmetic laser. The recurrence rate is expected to increase 6 months to a year after removal. Recurrence is an issue in syringoma removal. Unfortunately, one cannot be sure that once removed, the syringoma will not reappear. Looking at the causality of syringoma, this appears to be familiar. Also, syringoma, both periorbital and eruptive, appear during puberty, and they do not go away unless removed. Syringoma removal can be very frustrating due to the recurrence rate. The only study that we could find shows that 2 months after CO2 laser treatment, meaning removal by laser ablation, of periorbital syringoma, nearly 15% showed no improvement. This means that despite the complete ablation of syringoma, 2 months later the syringoma returned in 15% of the total cases in the study. And again, this was the only study that we could find on syringoma recurrence. It is assumed that recurrence rate is even higher 2 months after removal. In other words, if the recurrence rate was found to be 15% 2 months after complete removal, this percentage rate could have increased in 6 months to a year. However, we do not have access to data of any study beyond the 2 months mark period. Therefore, there is no guarantee that after complete removal, syringoma will not recur. For this reason, most of those who undergo syringoma removal will require to undergo further sessions as these unsightly lesions reappear. Syringoma remover. Imagine waking up in the morning and realizing that the concealer you previously used to hide your syringoma is not needed any longer because you have a simple and complete home treatment to remove your syringoma. Today, You do not need any lasers or any other expensive treatments, because today the Syringoma remover can remove your Syringoma. The Syringoma remover removes your Syringoma from the comfort of your home without anesthetic, in complete safety and comfort. The Syringoma remover is safe. It is developed in a gel-like consistency to avoid drips. It is manufactured, packaged and labelled by a ISO 22716-2008 DNV Diagnostica Veritas laboratory in Europe. It is a cosmetic peel made to remove Syringoma. It is not a medication. It is safe thanks to the peel types we use in the Syringoma remover. It is safe for home use. We do not use TCA. The only peel whose effects can be stopped by simply wiping it off and rinsing with water may not be possible with alternative TCA peels available. Inexpensive, very unlikely to leave scars, easy to use, save tons of time and money. It even removes thick Syringoma in 80% of the cases. The Syringoma recurrence rate is 20%. However, in this unlikely case, the Syringoma remover can be reapplied onto the new Syringoma and remove them again. What are the ingredients? The Syringoma remover is based on different types of peelings depending on your Syringomas and skin type. The most common are based on glycolic acid and vitamin A and other natural ingredients that effectively help to remove your Syringoma. We are using two main ingredients. One is glycolic acid with high percentage in the region of 70 to 95%, and the second one is vitamin A with its highest allowable concentration. The Syringoma remover is also a service. We can assist you online if you have any question. You can also opt for the money back guarantee option. This means that if you are not satisfied with the results, we will refund you in full. Why is the Syringoma remover safer and better than any other peels for treating Syringoma? Generally, there are very low risks in applying specialized peels to achieve complete Syringoma removal. Peels are generally the preferred option for Syringoma removal. This is because they are inexpensive and proven not to cause scarring if used properly. The peels that you find online may have lower quality control behind them, especially because you usually get what you pay for. They also lack the special additives that is required to make the treatment safe at home. What type of peel is right for your skin? What is the best peel concentration for your skin type? If you have any question, do you think other merchants will be able to help you with useful information about Syringoma removal if you are in need of it? Instead, we can help you throughout the complete removal process. Alternative cosmetic peels can easily cause dangerous strips during the application. Additionally, they do not have the same effectiveness in the treatment of Syringoma as the Syringoma remover. The areas affected by Syringoma are generally more delicate than other parts of your skin. Therefore, you want to make sure that the solution you are applying close to your eyes is of the highest quality and not too corrosive or damaging. This is one of the reasons why the Syringoma remover is made by an approved ISO 22716 DNV lab. The Syringoma remover is better than most other treatments for removing Syringoma because the specialized peel has been used for several hundreds of people worldwide to remove Syringoma and similar benign skin lesions. Safe, thanks to the peel types we use in the Syringoma remover, it is safe for home use. We do not use any TCA. The Syringoma remover has been developed to minimize the likelihood of contact with the eyes due to its gel-like thick consistency. This will minimize the risk of drip formation during its application. The ingredients selected are guaranteed to be of the highest quality to remove Syringoma on one of the most delicate parts of your skin, your eyelids. In case of Syringoma recurrence, you can repeat the treatment as many times as you like because you have plenty of product available for you. If you have any question about your cosmetic treatment after purchasing the syringe remover, we are here to help you with our advice. All you have to do is just email us your up-to-date pictures. We will answer your questions and we will advise you throughout the treatment. How does the syringe remover work? The syringe remover is not a miracle cure, it just works. But how does it work? The syringe remover works by chemically ablating the syringoma from the top. In other words, the syringe remover destroys the syringoma by peeling them off. It does not cure your syringoma. As you apply the syringe remover on your syringoma, you may feel a slight burning sensation. This is normal. This burning sensation will only last 5 minutes. 2 days after the application, scabs may form and they will fall off by themselves. At that point, the thickness of your syringoma should have decreased visibly. Repeat the application at the intervals suggested in the instructions, and after a few sessions with the syringe remover, you will get rid of your syringoma completely. So you will be able to notice the improvement almost immediately. Some clients require more and other fewer treatments depending on the thickness of their syringoma. One advantage of using the syringe remover is that you can decide when you are satisfied with the results. If you think that you still want to keep removing a tiny syringoma residue, you can still do so. You are in control of the treatment and you can continue until complete removal. The new glycolic acid based syringe remover. How does it work and what is the difference? The new syringe remover removes any type of syringoma and can be used on any skin type. After using TCA based syringe remover on a number of customers, we realized that we needed to find an active ingredient that would not be as difficult to control as TCA. The problem was that the syringe remover was the first product of its kind for home use. The drawbacks of TCA, despite its proven efficacy in removing syringoma, are: when it is applied on the eyelids, it causes severe swelling on the upper eyelids or lower eyelids. Although the swelling subsides in all cases, this is worrisome to most people. TCA presents the risks of permanent hypopigmentation in some skin types. TCA is usually not recommended on dark skin types due to the risk of having permanent discoloration on dark skin into a white patch after the use of this type of product. It is difficult to stop its ablating effects unless an appropriate neutralizer is applied. The risks associated to TCA are a lot higher than other active ingredients, and if it gets in contact with the eyes, it can be quite dangerous. TCA is not very stable in a thick gel-based formulation. What this means is that after a few months, the TCA gel turns into a liquid. After conducting a research, we found a study made in Japan stating that the Japanese researchers have had success removing symplasma and syringoma using glycolic acid at a high percentage, namely 90% concentration solutions. We knew that glycolic acid was easier to use and milder than TCA without most of the side effects and risks of TCA. The advantages of glycolic acid are: does not need a neutralizer as TCA does. Glycolic acid does not cause the severe swelling caused by TCA 1 or 2 days after its application. There has not been reports of hypopigmentation on darker skin types. The effects of the glycolic acid-based gel can be stopped without a neutralizer by simply wiping it off and rinsing the area with water. The depth of penetration of the gel into the skin can be regulated by changing the timing of the application. The longer you keep the gel on, the deeper the effects on the syringoma and the skin. It is not as dangerous to the eyes as TCA if it gets in contact with the eyeballs. Vitamin A in the new glycolic-based syringe remover. On top of the great results of the glycolic acid-based serum remover, we wanted to make the product even more effective in removing your syringoma. We wanted to make it in such a way that it is effective in removing any type of syringoma, and at the same time make our system very efficient in order to pass the costs cuts to you, our customers. The new serum remover with vitamin A is a standard product that works on all types of syringoma and skin types. Vitamin A. So how does vitamin A help us achieve this? Vitamin A in skin products has cellular stimulation properties that makes it a potent exfoliant. The glycolic acid has the double function of dissolving your syringoma and at the same time opening the syringoma tissue to vitamin A. Once vitamin A gets in contact with the base of your syringoma, then the cellular stimulation takes place. One of the several advantages of using the serum remover is that you can decide when you are satisfied with the results. If you think that you still want to keep removing a tiny syringoma residue, you can still do so. You are in control of your treatment and you can continue until complete removal. How to apply the serum remover? The serum remover is applied using a small makeup brush or cotton earbud directly on the syringoma, taking particular care to avoid contact with the eyes. It can also be applied using your own fingertips, whichever way you prefer. The serum remover has two main active ingredients. One is glycolic acid and the second one is vitamin A. Apply a blob on every syringoma. It is important to apply a small blob of serum remover and leave it on the syringoma for a period of time. It is always advisable to have someone else to apply the serum remover for you. Notwithstanding the safety of using the serum remover, we always advise our customers to be overcautious and apply as little serum remover as possible the first time it is used. After all, this will allow you to get used to the way the serum remover works. It is also recommended to avoid applying the serum remover onto the healthy skin. The serum remover should only be applied to the syringoma. In case the serum remover is accidentally applied onto the normal skin, just wipe it off. Since the serum remover is developed for home use, there is no need to rush the cosmetic treatment because the serum remover can be applied as many times needed until you are satisfied with the results. During the cosmetic treatment with the serum remover, it is strongly recommended to avoid sun exposure. If sun exposure cannot be avoided due to work commitments, when outside, walk in the shade and wear very dark sunglasses. Not other creams should be applied to the area around the eyes throughout the duration of the treatment. Once you are satisfied with the results, because you have removed your syringoma, the treatment can be stopped. Then makeup can be worn 2 weeks after the last serum remover application. Also for the period of 2 to 3 months after a syringoma removal treatment, total sunscreen must be applied to the area around the eyes before going in the sun. We advise our customers not to sunbathe for a minimum period of 3 months after the last use of the syringoma remover. Illustration: syringoma on lower eyelids. Additionally, throughout the treatment with the syringoma remover, strictly no makeup should be worn. Although very unlikely, wearing makeup could cause unnecessary complications that can be easily avoided. Also, avoiding wearing makeup speeds up the natural skin recovery process. Makeup can be regularly worn 2 weeks after the last treatment. On average, 2 applications are enough to achieve complete removal. However, since you have a lot of serum remover with you, you can repeat the treatment. After all, we supply 30 ml with your order, which will last you for a whole year. If you are not sure, you can always ask us. We are here to help you. Our recommendation: in the past, we instructed our customers to keep the serum remover blob for a length of time varying from 30 minutes to complete absorption 1 or 2 hours. The longer the gel is kept on the lesion, the stronger the peeling effects. Please note that TCA solutions bought from other sources do require the use of a neutralizer after a set length of time. It is also very important not to stand upright when applying the blob. This is because gravity could have the blob to slip down to places where it shouldn't go. Therefore, we recommend to lie down while you have your syringe remover blob on. In some cases, depending on where the syringoma are located, lying down may not be the best option. Remember, as a general rule, that gravity has to point towards the syringoma so that the blob will be naturally kept in place and not slip elsewhere. We highly recommend having someone else to apply the syringe remover blob for you. If you have syringoma on the upper eyelids, it is very important to keep your eyes shut over the length of the entire application. This is because if you accidentally open your eyelids, the blob could spread to other areas where it shouldn't go. Once again, it is important that you are not alone while you have the small blob on, because the other person can supervise the cosmetic treatment and monitor whether the blob is still where it should be. The other person will therefore help you by monitoring the gel and keep a clean cotton cloth at hand and make sure the gel does not slip anywhere else. In case the gel escapes, the other person can wipe it off immediately. Also, given that most likely you need to keep your eyes shut during the peeling with the syringe remover, the other person can help you in case you need anything, like bringing you water or whatever else you may need. Moreover, the other person can monitor the length of the entire peel period and wipe the gel off at the right time as stated in the instructions. Syringe remover ingredients. The new syringe remover can remove any type of syringoma and can be used on any skin type. Initially, we used TCA in our syringe remover, but very soon we found an issue with that. The problem was that 1 or 2 days after the syringe remover was applied on the eyelids to remove the syringoma, severe swelling would develop. This was worrisome to most people, although the swelling would subside on its own within 5 days to a week at most. Moreover, TCA is relatively difficult to control as it is best used with an appropriate neutralizer. Immediately, as we noticed this problem, we started working towards a solution. We carried out some research and fortunately we found a study published by a Japanese university. In that research paper, it was mentioned that a 90% glycolic acid solution was used successfully to remove a particular type of benign lesion with an extremely high success rate. So, we have asked one of our labs to make a glycolic acid based gel with a high percentage of glycolic acid in the region of 70 to 95%. In the early stages of the glycolic acid based gel, we found it was an effective solution, but still the glycolic acid was not as effective as TCA. So we needed another ingredient to make this product better, and vitamin A is the ingredient which we were looking for. We did further research on vitamin A. We found that vitamin A is allowed in cosmetic products within a certain percentage. So we are using nowadays vitamin A and glycolic acid in the syringe remover. So basically, we are using two main ingredients. One is glycolic acid with a high percentage in the region of 70 to 95%, and the second one is vitamin A within its highest allowable concentration. Vitamin A in the new glycolic-based syringe remover. On top of the great results of the glycolic acid-based syringe remover, we wanted to make the product even more effective in removing your syringoma. We wanted to make it in such a way that it is effective in removing any type of syringoma and at the same time make our system very efficient in order to pass the cost cuts on to you, our customer. The new syringe remover with vitamin A is a standard product that works on all types of syringoma and skin types. So how does vitamin A help us achieve this? Vitamin A in skin products has cellular simulation properties that makes it a potent exfoliant. The glycolic acid has the double function of dissolving your syringoma and at the same time opening the syringoma tissue to vitamin A. Once vitamin A gets in contact with the base of your syringoma, then the cellular stimulation takes place. As the cellular stimulation takes place, the syringoma is removed much more easily. One of the several advantages of using the syringe remover is that you can decide when you are satisfied with the results. If you think that you still want to keep removing a tiny syringoma residue, you can still do so. You are in control of your treatment and you can continue until complete removal. Frequently asked questions about the syringe remover. Can the area where scab form touch the water? For example, when bathing or washing my face, should I treat it as normal or can I only wash the areas around the scabs? If scabs form, this is a normal part of the aesthetic treatment. All you have to do is making sure you do not cause or increase any chances of infections on the treated area, especially while the scab is in the process of forming. You can wash the area normally with water and non-aggressive soap. Just make sure you keep the area clean, and while you dry your face, you use a very clean towel. You do not want to expose the area to unwanted dust or any particles which could increase chances of infection. Remember to avoid the use of any makeup or other creams during the scabbing process. Do not pick the scabs. Does it always work? Yes, it does always reduce the thickness of your syringoma. So far, nobody who used the syringe remover has opted for surgical excision or laser treatment. Please note that sometimes syringoma can be very persistent and they regrow despite the method used to remove them, be it the syringe remover, lasers, or cautery, etc. How do I know you are genuine? Very simple. We are Areton Ltd, based in the UK. We have supplied several hundreds of specialized peels the world over for a while now, with great results. We would not be able to be in business for a long time if our products were not effective and safe. We comply with all the strict cosmetic regulations in Europe to guarantee safety, quality and efficacy. Additionally, we are using PayPal. PayPal has strict rules, and if a vendor wants to use PayPal, it must comply with all its strict rules, and we do, of course. PayPal is now one of the largest portals for online payments and it has a worldwide reach. No scam can occur through PayPal because as a multinational, multi-million business, being affiliated with a fraudulent business would seriously damage its reputation. How does it work? The syringe remover is not a miracle cure, it just works. But how does it work? The syringe remover works by peeling the syringoma from the top. In other words, the syringe remover destroys the syringoma by peeling. It does not cure your syringoma. As you apply the syringe remover on your syringoma, you may feel a slight burning sensation. This is normal. This burning sensation will only last 5 minutes. 2 days after the application, scabs may form and they may fall off by themselves. At that point, the thickness of your syringoma should have decreased visibly. Repeat the application at the intervals suggested in the instructions after a few sessions. You will get rid of your syringoma completely. So, you will be able to notice the improvement almost immediately. Some clients require multiple and other fewer treatments depending on the thickness of their syringoma. One advantage of using the syringe remover is that you can decide when you are satisfied with the results. If you think that you still want to keep removing a tiny syringoma residue, you can still do so. You are in control of your treatment and you can continue until complete removal. How is the syringe remover applied? The syringe remover is applied using a small makeup brush or cotton earbud directly on the syringoma. Alternatively, you can use your fingertips. Avoid direct contact with the eyes. It is always advisable to have someone else to apply the syringe remover for you. Notwithstanding the safety of using the syringe remover, we always advise our customers to be overcautious and apply it as little syringe remover as possible the first time you use it. After all, this will allow you to get used to the way the syringe remover works. It is also recommended to avoid applying the syringe remover onto the healthy skin. The syringe remover should only be applied to the syringoma. In case the syringe remover is accidentally applied onto the normal skin, just wipe it off. This will stop the peeling effects. Since the syringe remover is developed for home use, there is no need to rush the cosmetic treatment because the syringe remover can be applied as many times needed until you are satisfied with the results. During the cosmetic treatment with the syringe remover, it is strongly recommended to avoid sun exposure. If sun exposure cannot be avoided due to work commitments, when outside, walk in the shade and wear very dark sunglasses. No other creams should be applied to the area around the eyes throughout the duration of the treatment. Once you are satisfied with the results and the treatment is stopped, then makeup can be worn 2 weeks after the last syringe remover application. Also, for the period of 2 to 3 months after the syringoma removal treatment, total sunscreen must be applied to the area around the eyes before going in the sun. We advise our customers not to sunbathe for a minimum period of 3 months after the last use of the syringe remover. Additionally, throughout the treatment with the syringe remover, strictly no makeup should be worn. Although very unlikely, wearing makeup could cause unnecessary complications that can be easily avoided. Also, avoiding wearing makeup speeds up the natural skin recovery process. Makeup can be regularly worn 2 weeks after the last treatment. On average, 2 applications are enough to achieve complete removal. However, since you have a lot of syringe remover with you, you can repeat the treatment. After all, we supply 30 ml with your order, which will last you for the whole year. If you are not sure, you can always ask us. We are here to help you. How long does it take for the scabs to fall off? In case of laser treatment or cauterization, it usually takes in the region of 1 week for the scabs to fall off. When using certain types of TCA, it may take in the region of 1 to 2 weeks for the scabs to fall off. The length of the scabbing process will depend on the formulation used and the percentage of the peel you have used, how you used the product, for example, if you used a neutralizer. If you're using the syringe remover, the scabbing effect usually lasts in the region of 1 week. The length of the scabbing process will depend on the length of the application. The longer you keep the syringe remover on, the more effective the product will be and the longer the scabbing process will last. How many times should I apply the syringe remover to remove my syringoma? On average, it takes in the region of 3 sessions before the syringoma are gone. In case of particularly thick syringoma, it can take more sessions, but usually 3 sessions are more than enough to achieve satisfactory results. Therefore, you have to be a little patient and repeat the treatment until you're happy with the results. On the other hand, you have a lot of syringe remover with you because we usually send you a lot more syringe remover than you need, just to make sure you will be completely satisfied with the results. Please note that some syringoma can recur and tend to grow back very quickly, despite the methods used to remove them, including laser, electrocoagulation, electrofuguration, and electrodesiccation. Also, you might want to use the syringe remover to manage the recurring syringoma. If the syringe remover is so effective, why have I not found it on the NHS in the UK? Syringoma removal are considered to be a cosmetic procedure, and the NHS in the UK does not cover any cosmetic procedure. Once diagnosed, the GP or dermatologist advises the patient to refer to a private cosmetic clinic if he/she wishes to have them removed. So, the NHS does not use the syringe remover nor any other treatment because syringoma removal is not a medical procedure. If you suspect you have Syringoma, refer to your local GP for confirmation before attempting any treatment. Is it necessary to use healing products during the scabbing process? No, it is not necessary, and it is not suggested either. This is because some of the products available may not be suitable for this application, and the use of unsuitable products could lead to infections in some cases. The best practice is to keep the area clean and let the scabs develop and fall off by themselves. Is the treatment approved in my country? Please note that the serum remover is not a healthcare product, not a medical device, nor medicine. It is a specialized cosmetic peel to remove Syringoma. Please let us know if you are aware of any country where the use or sale of cosmetic peels is illegal. We use glycolic mandelic acid and not PCA. We do not add any medicines to our products. As far as we are aware, no country has ever forbidden or restricted the use and the free sale of cosmetic peels, especially the ones we use in our formulations, as they are deemed safe by the international scientific community. The serum remover is a custom-made cosmetic peel highly specialized to treat Syringoma. Therefore, there is no restriction that we are currently aware of. Should you be aware of any local legislation which forbids or restricts the use of AHAs, please do not hesitate to contact us. Is the treatment with the serum remover painful? No, you may feel a slight tingling sensation, but it is about it. So you do not need to apply any numbing cream or product before applying the serum remover. What are the ingredients? The serum remover is a cosmetic peel with the intended use of removing your Syringoma by exfoliation. Strictly no medicines are added to our formulations. So we do not cure your Syringoma, we help you exfoliate them until you are satisfied with the results. Main ingredients of the serum remover are glycolic acid and vitamin A. We do not use any TCA. What can go wrong? The risk associated to the use of the serum remover are very low and almost negligible. If you're not sure whether you could be over-applying the serum remover and you're a little concerned, just send us your pictures and we will advise you. Or if you are concerned about anything else, either call us or email us. It is okay to ask. If your Syringoma are almost gone and you have tiny residues, you can also email us your pictures and we will be happy to advise you before performing any subsequent application. Some people have asked us, why is the sample remover more expensive than other peels I can buy on Amazon or eBay? They are cheap and your serum remover is far more expensive. The serum remover is formulated to remove your Syringoma. In this way, we are able to maximize the success rate. Therefore, you can remove your Syringoma in complete safety. The other products available online have not been formulated to remove Syringoma. We are also here to help you throughout your treatment until your Syringoma are gone. You can order peels online on eBay, Amazon, Google Shopping, and many other sources. Their cost can start as low as $30 plus shipping, depending on where you are in the world. But what concentrations are best suited for you? Do you know what the best treatment is for your case? At SyringomaRemoval.com, we only specialize in treating Syringoma. Therefore, we can easily assess the best treatment for your case by looking at your pictures. If you use the wrong peels or concentrations for your skin type, you will put your skin at unnecessary risk. What is the quality control of the suppliers on eBay, Amazon, and so forth? You hope is good, but we have no control over other people's quality control after all. They are so cheap, so who knows? On the other hand, we know that our quality control is guaranteed to be premium. What happens if the solution you purchased by yourself is too strong for your skin type, or you purchased the wrong peel? You may already have the answer. We think you may be putting yourself under unnecessary risk to save a little money. So do you really think that saving $150 or $200 is worth all these risks to your face and your skin, and your eyes. At SyringomaRemoval.com, we believe that a client is better off by paying a premium to have their syringoma removed with a laser rather than incurring the risks of a DIY syringoma treatment. However, if this is what you still intend to do in order to save a little money, we provide enough information on our website for you to buy the ingredients from your own sources and treat your syringoma yourself. However, we do not recommend it. What is the shelf life? The shelf life of the product is 12 months. The expiry date is displayed on the label on the syringe remover. Where can you ship the syringe remover? We can ship the syringe remover worldwide for the price we state on the website. Wherever you may be in the world, as long as there is a postal service available, you can receive your syringe remover at your doorstep. We use recorded delivery as a standard. Who are your customers? Due to our business model, we serve customers the world over. We shipped our products to Canada, UK, Australia, US, South Korea, Hong Kong, Malaysia, Singapore, New Zealand, and most parts of Europe. Our customers are usually those individuals who have had syringomas for years, and especially those who suffer from syringoma recurrence after removal with lasers. Most people with recurrence problems have come to us because they know well about the inconvenience, risks and costs of surgical excision every time the syringoma reappear. The low cost of this product makes the syringe remover the best long-term effective treatment to remove syringoma. Why is the syringe remover safe for home syringoma removal? Some people are worried that they could get the exfoliation of their syringoma wrong if they use the syringe remover on their own. We have taken all the worries away by simply giving you the best formulation to suit your syringoma. We will not use nor send you any medicines, of course. The treatment is merely cosmetic. We have moved away from the use of TCA, and we are now only supplying milder peels like glycolic and mandelic acids. This type of peels can be neutralized by using water, as corroborated by scientific research. When we refer to neutralizing the gel, we essentially mean stopping its effects. This cannot be easily done by using TCA. Additionally, once you place your order with us, we make the commitment to help you throughout the treatment until you're happy with the results. So you only need to make sure you apply the syringe remover as instructed and nothing else. We have already thought about the rest. We have given you the best formulation for your skin type, and we will guide you through the process step by step through the clear instructions. At the time of writing, our cosmetic formulations have been used by hundreds of people the world over. Why should I choose SyringomaRemoval.com to remove my syringoma? We have developed this website to exclusively deal with syringoma and nothing else. Clinics that use similar peels or other equipment are far more expensive than us. Given that we are so specialized, removing syringoma is second nature to us. Our specialized peel products have been very effective in improving and removing syringoma. Not only is the syringe remover one of the most cost-effective ways to remove your syringoma, but it is also safe, fast and inexpensive. The syringe remover formulation has been customized to remove syringoma. To date, nobody who used the syringe remover has been scarred by this cosmetic treatment and has been very satisfied. We are the only company offering a full money-back guarantee if you're not satisfied with the results.
The end.